This first slide by me try for explaining how the US health system work. Make no mistake, the system itself can be very complex, and there are lots of interactions between various players. Therefore, just one slide alone, but I'm not explaining everything. But the whole purpose of this slide is try and compare US health system with them system lo solo, and there are advantages and disadvantages of each system. But what I want to outline is just briefly how the system work here in the US, and we might try to identify ways that we can actually either combine both or improve ways that we can actually have the best of both systems. So here in the US, all the infrastructures are owned by either corporate entities or individuals, and they are all private. In a sense, because the government doesn't really have a say in majority of how the hospitals work, or urgent care work, or doctor's offices work, and all that. And so clinically, all the people should have a primary care doctor, and it's through the primary care doctor that they get their health care from. And so majority of the time, health maintenance, health issues, any kind of problem you got them, you have to go through your primary care doctor's office now. And if need to be, then your primary care doctor will refer you to a specialist where they actually will treat you further. Now, some local people there goes directly to the emergency department to get their health evaluated. And majority of the time, these are supposed to be acute illnesses, or if they are life-threatening, then they go directly to ER to get emergency services. Now, if the doctors lo ER or evaluating you and they think that the individual is okay, they can discharge and to be followed up by the primary care doctor. Now, if on the other hand it needs admission for further evaluation and also stabilization, then they get admitted to the hospital. And after they are stable, and they get discharged back to the primary care doctor's office to be followed up or follow up by the specialist. Sometimes because of insurance requirements, the primary care doctor's office has to authorize some of those follow-up services by the specialists. So that's how the system works in here. And then, of course, if the primary care doctor's office is kind of full, the doctor's schedules are full, then they usually, the patients are usually seen at the urgent care centers. Now, these urgent care centers can be part of a primary care doctor's office and all the hospital services. They are not necessarily part, or the building itself is not actually part of a hospital. They can be in a separate location altogether. And so patients can actually be seen there, and then once they get their treatment, they usually are requested to follow up with the primary care doctor for further evaluation. And so that's how these different entities interact. Now, who pays for all these services? Now, obviously the health insurance pays for everything. The health insurance itself, there is a private health insurance. This you can actually buy apply and start paying your premiums, just like car insurance, and or you get it through the government. Now, the government provides health insurance to you, but with very strict criteria. So they offer insurances through various programs. One of the program is called Medicare. Medicare actually takes care of all the individuals who are 65 years and above, or young individuals with disabilities and or things like end-stage renal disease on dialysis. And again, they have strict criteria to be enrolled in these programs too. And within the Medicare itself, there is different plans too. And then you have the Medicaid. Um, Medicaid is actually a government-funded health insurance, but it's also offered via other private insurance companies too. Yeah. So the carrier itself is a private company, but the money comes from the federal government. And so this Medicaid actually helps people who do not have the resources to provide insurance for themselves. Those who are so-called poor or under the poverty line, they go into this. And then the other program that the government offers is the vet system, where got the former military officers or the or the military personnel or they use him now. This will be a health insurance system, and then we have the children's health program insurance. So these different types of programs are funded by the government. So that's how the whole system is funded. So you have basically the health insurance offered by the private, and then you have insurance that are funded primarily by the government. And so they have their own, reimbursement amounts to you. So you tend to have private insurances that are offered through job employment, or individuals just basically buy off the plans, and these plans have different coverage, um, uh, offer different coverages, law the plans law that to you. So you can have like co-payment, they call it, where you go looking at the doctors and you don't have to pay nothing. Whereas some you have to pay like $20 each visit, and then the rest of the visit requirement is funded by the health insurance. And so usually what happens is the specialist office or the primary care doctor's office or the emergency or the hospitals or the urgent care centers, they actually bill the insurance with them whatever services they done to you. So if they did offer you ECG or blood tests or whatever, they bill the health insurance, and then the health insurance, through their contractual agreement with them, the doctor's office or the hospital, they then pay the services. So say a doctor's office visit cost about anywhere from $100 to $200, for example. Then the insurance will actually pay the full amount, and or depending on your premiums, they pay a certain amount of it, and then you meet the rest. And so that's how the system is being funded. Compared to Milo Solo, I'm different a little bit. The government actually funds everything. Hemi take care of the workers, it takes care of the infrastructures, it takes care of the pharmacy, it takes care of the ambulance services and all that. Lo here lo US Hemi different a little bit. The pharmaceutical companies or the pharmacy, they are private individuals. Now, if you go to a into a like for example, county pharmacy, those are kind of like non-for-profit pharmacy. So government gives them subsidies. Um, Going back to like doctors' offices, specialist offices, and also like hospitals and all this. Now, some local hospitals here in the US, they are non-for-profit, like NGOs, and so they operate under that status. Compared to other hospitals, they are for-profits. Majority of the time, these for-profit hospitals, that is what they are for. They're business, and so they try to make profit as much as possible. Um, and so the main difference between UMI Los Solo and the US is the health insurance itself. UMI Los Solo is primarily the government that does everything for us. Now, UMI Los Solo, I think probably we need to encourage the the employers to get health insurance as part of uh, employment contract, so that way I think probably him help out law, not only building up infrastructures but providing quality of care, improving payment for the doctors and nurses. So it gets extra money from that source rather than just basically through the government. But again, it needs a lot of system development too in place to in order for everybody to benefit from it. Because right now, I doubt there is infrastructures in place that you can actually build health insurance and all that. So hem noma a little bit story lo here lo USL system slide. Thank you too much.